Nala Anderson. I'm a 21-year-old social work major here at Southern University. And the problem that I'm addressing in this project was basically adults that were suffering with mental illness and also being homeless. So the two interventions that I decided to use was both case management and also independent housing. So the first case study that I will be talking about is dealing with the intervention of case management. And within this one, for Chemin, the population varied from 15 major cities with at least 100 in each study in each one of those cities during the 12-month evaluation. The method that they used for sampling was a purposive sampling method, meaning that they were selective and they did not do random selection when they chose their clients. They interviewed for the participation of this study by evaluating on social demographics, characteristics, housing status, psychiatric symptoms, substance abuse, length of time of being homeless, physical health status, social support, employment, income, and criminal involvement, and so many other ones as far as picking their participants who will later on be clients. For the intervention, the case managers were rated based on their services categorized as therapeutic alliance, demographic variables, clinical and social functioning, and substance abuse. And through those different categories, they were rated from their clients as either having no relationship with them, a low alliance with them, meaning sort of kind of had a relationship, and then a high alliance, meaning that they felt like they had a really positive and great relationship with their case managers. The results show that throughout the 12-month period, with the first, because there were three different interviews throughout the 12 months, starting with a baseline one, and then after 3 months, and then also one at the end, which is the 12-month interview. And with that, they started off with a very high rating as far as participants saying they had no type of relationship with their case managers, and a very low one saying that they did. So with that, it steadily increased as far as those saying they had a higher alliance, and it steadily decreased with those who said they had no relationship as time moved on. So basically, as time continued, the candidates said that their relationship got better and better with their case managers. And the only limitations that I saw with this study was that basically it was a selective group, meaning that it wasn't randomly assigned, meaning that it's some bias within the. We look at Clark and authors. There was 152 participants that varied in race, gender, income, and schooling accomplishments. All clients were either homeless or at risk of being homeless and clinically diagnosed with mental illness. 83 participated in the housing and 63 participated in the case management only. Those were the two groups that you could participate in. Interventions included case management programs that included active outreach, engagement on-site counseling, assistance with obtaining housing, and medication and medication management, as well as other things for just the case management only. Now, when looking at the housing program, they had guaranteed access to housing, support services, case management, and priority access to everything for medication and as well as vocational services. Results showed higher level of achievement with both case management and housing versus just only having case management. But they also mentioned in this study that depending on the characteristics of the actual client or participant is what they really needed. So if you had the lower symptoms of psychiatric problems, you probably only just needed the case management. But those who were dealing with the higher level of symptomatics as far as having higher psychiatric problems needed to be in both the housing and case management. Now to our second intervention, which uses the case study of independent housing or independent living to address the problem of mentally ill homeless adults. When looking at Holberg's intervention, he uses the same population as Goldfinger, who is our other author and case study within the intervention of independent living, but he uses comprehensive case management and traditional case management with either the options of having a Section 8 certificate or no certificate for a Section 8 for both of those. So then you have 4 different groups within this one. And the access difference as far as comprehensive case management was that those case managers who were part of the comprehensive case management was available 24/7 for all of their clients, and it also had a smaller caseload compared to the traditional case managers who are a part of the traditional case management with the certificate for Section 8 or no certificate for Section 8. This showed for Holberg's study that there was really no relationship as far as the manipulation within the experiment, but you did have the 10% who was moving place to place and really couldn't find a stable home, and then you also had 19% within the program who also struggled with finding stability as far as within the homing. But they said that there was really no real relationship as far as switching up the case management and as far as like having certificates as far as Section 8, because they also offer within the program the ability to find housing. Now, looking closely at Goldfinger's case study, his had the 2 groups, which had independent apartments, and then also they also offered the staff group homes. Now, looking at the independent apartments, they were operated by Housing Authority, and those in that program had a once a week program meeting or group type meeting. And those who were in the staff group home, they will offer more services as far as like clinical staff and more programming. And the results show for this one that those who spent time with the program as far as independent housing spent more days homeless than those who were in the staff group home. So it showed that the staff group home was better for those as far as mentally ill instead of the independent housing, because you do need that more support and also as far as more treatment when getting better. So also, wrapping this up, I believe personally, and I will recommend personally, that the intervention case management will be better for those who are adults and they are mentally suffering from mental illness than that of independent housing or housing really, because when you think of mental illness, it starts mentally. So you need that support and those services and that person to kind of keep you on track as far as that path of getting better before you can really think about housing, because you have to first focus on yourself as far as mentally and psychologically before you can move on from not being homeless. So that wraps up my interventions for adults suffering with mental illness. Thank you.